Hey. You're welcome. Thanks for
Yes.
joining.
Thank you,
Thank
Mira.
you. Yeah, I'm fine. Thank you. And you?
Good, thank you.
Oh, I'm so happy to have you here today. It's my pleasure. I'm so thrilled. It's so amazing having you. So, how are you doing?
I'm doing good. Thank you for
Oh,
asking.
oh,
Yeah.
we thank God. We thank God. I hope the volume, the sound is okay. Everything is okay. I hope it's
Every
okay. You get me?
yes, I'm getting you 5 on 5. I don't know if my
Oh,
background is the lighting good.
yeah, maybe try just switch it. Let me see if it's okay. If not, then you can put it on. Just try to switch it because it's reflecting actually.
Okay, let me see.
Yeah. Try to off the light and then let's see. Voila. It's
It's
no, but it's
better.
making you dark. But it's good. It's good. I prefer it like that. It's good.
Uh, all, all right. Let me
Or maybe
see. Yes,
no, say
I wanted to ask if I could maybe switch on another light, which
it's very
may like.
okay. It's
Okay,
very okay. You can do it since we are still waiting for people to join. It's okay. Do it.
correct. Yes, just give me a second.
Yes.
Yeah.
Oh, take your time. Take your time. Thanks very
y-
much.
Yeah.
Yes. We are live on Diabetes Mindful Talk on YouTube. Please help me to share the video as you join. Let me try to share the video so that other people can join because today is going to be an amazing day. Yes, it's going to be awesome. We will be learning much from diabetes today. So help me to share the video as you join, please. I'm trying to share here also, so share wherever you are. Make sure to share the video so that people can join us. Share on Facebook, share on YouTube, wherever you are. Just share the video so that this message, if it go wide, people feel join and they feel learn something today because this show is a show like no other. It's going to be an educative show, a show where they're going to talk now out of experience. So if you all imagine how the show it will be. So please help me to share the video as you join. Yes, we are live. We are live. Please share the video. Have fun it. Hello, we are here. Thanks very much, baby, for joining. Please help me to share the video all the way from Pays. Yes, you can join. Thanks for joining, baby. Thanks for joining. Please share status, Facebook, YouTube, TikTok, wherever. Help me to share it. Even if it's on TikTok. Are you on TikTok or TikTok? Instagram, just so that people can join us because today it will be a wonderful show. Show that we will be doing based on life experience. So let's share the video so that we can go far. Yes. I see you. I see you, Afani T. Claire. Thanks for joining, baby. Help me to share the video. Share on Facebook, share on your WhatsApp status so that other people can join us. Yes. Our guest is just trying to fix his light, but everything is good. We are good to go. Voila. Perfect.
Improve some more.
Very much good. It's really good now. Thanks very
Okay.
much. Thanks for
You're
joining.
welcome.
Yes. Thank you. Like I said, thank you very much for this opportunity, for accepting my invitation to be here on this show. And I believe by the end of the show, many people will learn from you because you are actually speaking from your experience. You know, go talk like best way, it just go school, go study about diabetes. No, but you will be speaking from a point of someone who has experience and someone who is experiencing or living with diabetes. So it's really going to be an educative show. And I hope at the end of this show, many people will learn from you and many people will take one or two lessons from what you are going to be teaching here today. So you are welcome on Diabetes Mindful Talk. That is my channel's name on YouTube. On Facebook, I am Mirabikono Diabetes Foundation. My aim is to create diabetes awareness in our Cameroonian community in particular because diabetes na something wey e no be spoken. People themselves when they get diabetes, they shy away from talking about diabetes. But as a medical professional, I thought it wise that maybe it's good I come out and speak about diabetes. Me speaking about diabetes, it will help other people them so that they feel know which way diabetes be all about. Because friends, people then get diabetes, but they don't know how to go on with their diabetes because they lack this information. But you being here and you accepting to be here to talk about your life's experience, I believe say it will add to which way I want to talk am all through for my channels them. So I am really happy and I will allow you for introduce yourself to us. So let me give you the space so that you can do your introduction. Tell us about you.
All right. Thank you so much, Ms. Mira,
My pleasure.
for
My
this
pleasure.
wonderful opportunity. With your permission, I would like to mostly speak in Pidgin because, like you said, we have the Cameroon community as our main target. And like a Cameroonian, I would like that my people should be able to better understand the experiences, I've lived as a diabetic patient.
That's
So
very
I'll
okay
be,
with me.
thank you. So I'll be very grateful for this opportunity where you give for me. And I appreciate the wonderful work you did do for create this diabetes awareness because I believe say if many years ago I will get somebody like you where it be fit sensitize me on this particular illness and how to avoid them or manage them. Probably I know for Phoebe they talk about the diabetes, but that notwithstanding, your program the
Mhm.
follow are the one of your followers, and it really help me for better
Thank you.
manage
Thank
my
you.
diabetes. So actually, my name na
Thank you very
Joseph.
much.
Thank you. My name na Joseph Ngwa. I be
Mhm.
Cameroonian. Currently, I dey for US, and I don't be a diabetic patient for about 14 years now. So
Mhm.
that is the small introduction about myself where I feel tell you.
Okay. Thank you very much. So you don't live with diabetes.
Correct. Yes. Yes, I did get you, even though the breaks mobile, I did get you. Yes, I don't live
You
with
get my
diabetes
point.
now.
You get
Yes,
it. Yes.
I don't live with diabetes now for 14 years, at least.
Okay. Okay. So you're diagnosed because now from your introduction you be based from America. So it means say you're diagnosed they be doing for Cameroon. So how you be know say you get diabetes? How you be know before you know say you get this diabetes in you?
Very good question. Thank you. So, wait till it happen, I say, I be the feel really dizzy. I dey feel very tired. I dey feel weak. And at times, I notice and to say, I be the be tested too much. I started drink a lot of water where this no be the situation before. And then I be the peace a lot. I be the peace a lot. But I know be actually know, I know be actually know which way it go on in me. Yes. Because I be a teacher, and I still be a teacher. So when I be the teach sometimes for class, I dey feel, very dizzy. So sometimes instead I dey struggle for support myself using the benches, hold am. I no be actually know wetin dey go on. But the main thing where it be make am I discover say it dey like say na diabetes. I don't get am. Na say as I've the peace a lot, especially for nights where it no be day like that. So whenever I be dey go for peace, I know they just flush the toilet pot at once. If you dey do them every time. So I be just leave them every night at the peace, then na for morning time now where I dey wake up, then flush the toilet pot. Then I can't notice on Sunday for morning time where I don't go for flush toilet pot, say, these small anthem where they used to be for sugar. So for Cameroon, those sugar anthem.
Yeah,
I
that
want
should
go,
have answered. Yeah.
yes, I want go flush toilet pot. I say inside toilet pot for my piece all around are those anthem the day for day. So now for day it be immediately ring a bell in my mind, say something be wrong, because I recall say I be don't once follow a program, even though I not really follow them, a program where you just get them by passing, and then they talk how one of the ways that way, if you know that you get diabetes, now if you piss, then you see these small ants them around.
Anthem.
So I recall now, say I be don't hear something like that. And now for day now where I will go do small findings, I see and say yes. It means say na sugar. Now why that way those ants them that they come around. And now for the way I be decide now, say no, I think it was time for me for go for hospital, go check in order to confirm whether or not I get diabetes. And when I will go for hospital, they be check them and then confirm say I be diabetic. Yes.
Okay. So
Yeah.
experience all those mention a couple of signs that we normally na signs that we person we either get low blood sugar level when it get diabetes, it experience or person where it get high blood sugar levels. For instance, you talk about you feeling dizzy.
Yes.
Dizzy, it mostly happen for people the way they get low blood sugar. And then you talk about you feeling so tired. Tired will also contribute to when your blood sugar levels then be high, but they just stay only inside your blood. They know they be carried into your blood cells, into your body cells, the way it make you tired. And then you be the peace too much. When another
Yeah.
if you been at diabetes now
No.
until you be see and say now that hands them they can't join for your PP that they think that way it ring bell for your head before it carry you go hospital. It means say if you be say that hands them they not be calm with the knowledge where you get out about hands and sugar. It means say you for still maybe by now they still live with that condition. I won't believe so or wait till you.
Correct, exactly. I for just today me with the condition, just visit me being a normal, tiredness or normal test and all the like, you know. So I know for feel no, yeah. Now that should that ask them that then be help me when I then recall say I be don't listen to a program like that. Now
Yeah.
it make them I decide for go for hospital like I for just sit on me.
Yes. So from which we don't learn and now, like we always think and say that sand there, it act na like a meat. Because while growing up, we hear our parents that be carry about sand and sugar when you pee. But now it's a meat that actually brought your doubts into a reality. So some of the myths that you find when we hear about something, we put it into consideration. So when you dey go for hospital now, you go do the tests. I don't know the kind of test where they be doing for you, but when you go out and you did whatever test that you did, they come out with the results, which will be our reactions? How you be feel, how you be taken?
I want be sincere to you, say I will be very demoralized. I be feel so bad because when I be go for hospital, the doctor will be meet them. I don't know if na lack of professionalism or what, but when he be do everything at that time, my sugar level be really high. It be there about 500. So
Wow.
immediately nurses they do everything. They send me to the doctor. He just look at. He tell me say it's serious, and if this thing they continue, so sure say he say at what age? Now the question that he asked me, he say at what age? Then look at your sugar level. He say if this thing they continue, so I even sure say I'll reach 40 or 50 years. Oh my God, that talk where he be talk so it worried me. Yes, it worried me. So till I come back, I was broken. Yes, I was broken. I only feel
I
bad.
feel imagine.
Yes, I be feel very bad.
Yes.
I weep, I cry.
I can
Yes.
imagine.
Yeah. So actually, now what did I be happen when I become for hospital with the sad news where doctor began for me regarding the sick. Yeah.
So if I will ask you, hey, Eyambe Elizabeth, thanks for joining. Please let me just try to greet some people and introduce our topic to them, because some people they are just joining us. You are all welcome to this show of today. We are live today. We are live with our brother who is going to, or who is sharing his experiences with us about living or managing diabetes while in Cameroon. So today we'll get a guest speaker in the house. He will share with us his experiences about diabetes. So if you join the show, please make sure to share the video, give the video a thumbs up, and also notify others to join, because it is a true life story. It is his testimony that he also. Let's invite people that can come and feed from, especially people who are in room. So please join me and create diabetes awareness in our Cameroonian community. Mama, a happy Elizabeth, thanks. So, Pa Joe, like I commonly call you, if I can call you, if it's okay with you, if I can call you Pa Joe or Mr. Joseph, whichever way you want, I will go with that.
Exactly. Anyone is good.
Okay. Yeah. So, okay, you said everyone say they discover normally the next be tell you say for this age where you did, which means you were really young when you were being diagnosed with diabetes. You feel help for tell we how old were you did? Nowadays, they believe say diabetes now sick way in the whole now old people them, or in the whole now the older generation. But seeing you as you sit down for camera, you are looking so young, and you said you have been living with diabetes for over 15 years, 14 years now. So how old were you when you were being diagnosed with this diabetes?
So I be there go in my 30s. I be there about 27, going to 27, 28. In short, my late 20s, going to my 30s when I will be diagnosed with diabetes. Yeah.
Oh, the internet is broken. Let me try this. I don't know, the connection is worrying. We have problems with the connection. Are you getting me?
I'm getting you 5 on 5.
Are you getting me? You
I
hear
am
me?
get.
Because the connection it broke, it freeze.
No, me I get you 5 on
I
5.
think
I
it's
hear you
okay
5 on
now.
5. Yeah, I hear you 5 on 5. So I say I'll be there in my late 20s, about 28, when I will be diagnosed with diabetes.
Okay, so now
Yeah.
Russia said diabetes no be now sick way in the whole na only old people then because our youths then now our days they believe say diabetes na two way in the whole na only people then the older generation then. But seeing the fact or hearing from you, you say you get diabetes now in your early 30s, which means that you really get diabetes when you were young. And
Yeah.
I can now believe what you said. It was really traumatizing to you because at that age, if you get diabetes, then you know really fine because you know say I don't know whether you will be briefed about which be diabetes or about whether not the thing that way it help for add to the for traumatize you all those things. Hey,
Yes. You know, like I tell you, what the way we help for traumatize me, now the respond way the doctor began for me. When he be look
Mm-hmm.
my age, when he be see my age, then he see my sugar level way be there that almost five something. He tell me
Mm-hmm.
say no, he say with your age and your sugar level for this number, I think say if you not be careful, 40, 50 years, you know, reach. So that one be really traumatized me, you know.
Mm-hmm.
Considering the fact to say at the time, you know, I was not yet married,
No.
so I not be get any picking yet, you know. Marriage picking a legacy for we African, you know, and Cameroon culture. So
Mm-hmm.
I was like, so it means say now the end is about me, you know,
Mm-hmm.
no legacy where you live So, you know, all of those things put together, they be really traumatize me and they be worry me a lot.
Okay, okay, yeah, of course. I feel imagine at that age, someone where you get a future ahead of you, the plan how
Yeah,
you get from marriage, you get future. Definitely,
yeah,
if any person get that kind of news or that kind of diagnosis, that person must be broken.
yeah.
But if I may ask, because from the experience about diabetes, the show say, especially for your age, you know, now two kind diabetes dey. So I don't know which kind of diabetes wey they be diagnose you with.
Yes, they will diagnose me with type 2 diabetes.
Okay, thank you very much. I just wanted to know that before I ask the next question. And we know say that type 2 diabetes, one of the risk factors the way it cause type 2 diabetes. Now they say now about genetics, either it be genetics or it be a lifestyle issue. So I don't know whether now when you see yourself, what you think, what you feel related to the cause of your diabetes. Was it a lifestyle problem or was it about genetics? You get any family history about diabetes so that we feel know how we feel educate more people that out there about diabetes, either on the side of genetics or on the side of lifestyle. So you feel help we for talk about that.
Yes, in my situation, I think both sides it be play
Okay.
because for genetic, for my papa side and my mommy side, I get people then
Mhm.
way they be diabetic. But again,
Okay.
I think to a large extent, lifestyle it be contribute to my diabetes to a large extent.
Okay.
Why?
Mm-hmm.
Because you know, at that time I will be young,
Mm-hmm.
I be the work, money be there, so
No
I be
family,
hardly the cook.
no
No
responsibility.
family, no family, no picking, and no be get any person where it is depend on me. So my
Mm-hmm.
salary will be completely, you know, used by me for myself. So
Mm-hmm.
I be the mostly chop now for a restaurant, all this fry thing them and all the like, you know, I be feel
Mm-hmm.
say they be good. So plenty time I be there now on them. Then I know be the, you know, do a lot of exercises. And in short, I know they do exercise at all. Then
Yes.
again, then again, I be the drink a lot. I mean, I be get a group of friends and colleagues we will be always there in drinking. And when I say drinking, I be the drink everything, you know, from beer to sha to wine, mimbo, just anything where I become across. So I
Anything
feel
will be
say
drinkable. Anything will be
anything will be
drinkable.
drinkable, you know.
Yes,
Yeah,
yes.
anything
Mm-hmm.
will be drinkable. So that lifestyle it be really greatly contribute for my sick because with my colleagues after school, for Cameroon, Africa as a whole, we get plenty time after school. Get place for go. The thing that say we don't go for bar. You go for bar. Say me, you take just one bottle. But by the
Yes.
time you call for one bottle, it finish, the next colleague say, no, bring another bottle. Before long, you want to see yourself, you day into 3, 4, or 5 bottles of, beer almost
Mm-hmm.
every day. Yes, almost every day. So,
Okay.
so, so all of that, they be greatly contribute. So to a lesser extent, I feel say yes, genetics, because on both sides I be get them. But I think if I believe a good lifestyle and not forget into it very early or so soon as it will
Yes.
happen. So
Yes.
lifestyle will also greatly contribute for me forget the sick.
Okay, thank you very much. Yes, because on my show, I dey often talk about if you want manage your diabetes, the first thing where you get for do now for live a healthy lifestyle. And
Yeah.
which will be the healthy lifestyle. This healthy lifestyle, like for you for eat healthy, make sure so you exercise. I always talk about alcohol. But now you coming out and then you dey confirm all these points them, it just help to like put a stamp on which way I don't already be talking for this channel. Then you mentioned about you being a teacher, you going out with your colleagues, your students. Then they be ever noticing a problem this way you the face am. Were they aware about this? Your students then.
No, my students they no be aware because even when I be used to the teach for class, I dey feel that weakness or so. They no be feel understand because I will support myself either on the table or on their bench. So they no be
Mm-hmm.
feel really know. They no be feel really know which way they go on. But now me inside, I be
You know what
feel
you go
inside
through.
and no say something be wrong or no be well because this one it no be done they happen for me before and I no be feel understand what it really go wrong. So my students then they no be know. And one of the greatest mistakes where I be make them we have feel say it be help for contribute too much to my crisis. Now say, with the lack of education, like I talk, I say this your program really be wonderful because it educate we a lot. With the
Thank
lack of
you.
education, when I be diagnosed of the diabetes and doctor be tell me about because they be asking whether I dey drink and I be confirm.
Mm-hmm.
So they
Of
be they
course.
be yes, they be want me for the alcohol and then tell me say if we dey for stop, ma stop them or reduce. But unfortunately, they no be tell me say sweet mimbo no be the best, sweet drinks. So I decide now for switch from
Alcohol. You go for
beer
sweet
to
mingles.
sweet drinks. I feel
Oh,
say na
oh,
better thing
okay.
where I dey do am.
Uh-huh.
So at times too, when you don't get this, club of friends, colleagues, and mates, so now they ever drink together, it's not easy. So whenever we be sit down now for drink, I'll say no, I no want alcohol. Me, they give me a sweet drink.
Sweet
So
mimbo.
you see me taking about 2, 3, with sweet drink, if it pass maybe 3 or 4. But as the drinks that they
Uh-huh.
come, so you see me taking like 2, 3 or maybe four bottles of top. So you see, I'd make that switch from beer to sweet drinks, feeling a better thing while they do. So almost every day again, at the
It
instant taking a sweet
increase.
drink, where it
Yes.
instead aggravate now the situation, the instant increase now the sugar. So, now one of the big mistakes then that why I be making where I know be sabi, I be feel as they say alcohol. Okay, I feel now switch to sweet drinks.
You
Now
restrict
the
only
best
to
thing way go be
alcohol.
for me.
Yes.
Correct, correct.
Okay.
So
Let me
yeah,
take this moment. I find it sick. Let's say, oh, from fry pan to fire. Me,
fire,
I go
correct.
actually for what from fry pan to
To
fire.
fire, correct.
Yes. Okay. If you feel permit me host my guest, I'm gonna read some comments the way people did write down for here about you. I don't know whether you for there if you see some question there. It be very okay. If you see any comments or question where you feel answer, make sure to answer them, please. And
Okay.
also for our audience, you guys, you are free to drop your questions. If you have any question for our brother Pajo, like we normally call him, please Leave him questions. This is an opportunity for us to learn. Let's learn from someone who is experiencing it live. Not me talking about diabetes. I'm not a diabetic, so I cannot really share these experiences like he is doing. So if you get any question, please drop your question so that he can best give us reality answers. And Crystal Zone is greeting, is sending her greetings to you. Crystal Zone is
Thank
sending
you.
her greetings. And Afati Claire is appreciating you for telling the truth and sharing your true life story with us. So she says she is learning too much from your experiences. So
Thank
thank
you.
you very much. And I'll greet all those who are joining. Dimas TV, I see you. Suzanne, I see you. Nebuchadnezzar, sisters of mine, thank you all for joining. Lady Bill, thank you all very much for joining. Okay, Pajo, I have a question for you from Afani Tikwe. She
Yeah.
says, Pajo, did your blood pressure increase in any way as your sugar levels were high?
I think it's a very good question that, and one of the
Mm-hmm.
things where I don't be a little fortunate about it until now, because
Mm-hmm.
I not say even my late pa, if they get serious serious high blood pressure, where
Mm-hmm.
naive greatly contribute to a die. Because
Mm-hmm.
when I be diagnosed, even I remember say doctor be telling me say it better forget. I don't know how true it be, but I say as an expert, you fit tell more say it better forget high blood first than the diabetes. Say because with the diabetes, high blood go quickly come in.
Mm-hmm.
So I be so happy say at this far I never yet get that high blood issue problem.
Wow.
All the time while we go hospital for Cameroon, they check on my blood, it be always the normal. And
Mm-hmm.
even for the time where I don't be here in the US, where I
Mm-hmm.
dey follow up my diabetes. Each time when I go, they check my blood pressure. It is always the normal. But again, they let me for understand, say, there may be a probability, say, if I know control them very well, the next thing we go follow another high blood pressure. So
Definitely.
I actually do my best to make sure say at least control that high blood.
Okay, and that is very important. Why? I'll try to throw a little bit more light about that relationship between the high blood pressures and the diabetes. The thing I say, when you get high blood sugar levels, most people, when they get high blood sugar levels, now because of their sugar, them for their skin, be controlled. Where it help for affect their blood vessels, them. This sugar, it will turn for black along the blood versus the way that they transport the blood there. But along the line, when this sugar it don't clot too much for your blood vessels, it will make away the passage for this blood flow. It will be so small. When blood the flow, blood now get for use now pressure to pass through that thing. Now, why that way you see and say most people they and when it use this pressure, now it cause that high blood pressure. Now, why that way you did see and say most people then when they get diabetes, it is often been associated with high blood sugar levels. Why? Because of this narrowed in their blood vessels, where it make and the blood flow in it go well. But thank God on your case, you don't really be aware, and up to now, you the manage and where you put your blood sugar levels under control, where it means say you know they take like drugs them for high blood sugar level. And I wish you send me you just keep an only for this level because diabetes is most often associated with high blood pressures. And like I explained, that just the simple reason that when you see how most people they when they get diabetes, that they get high blood high blood pressures because their blood vessels they are narrow, so the blood flow it flow freely or directly how it flows. So when the blood one flow, it come with pressure for give them all these high blood results. But then if you constantly get them, it means say constantly your blood pressures will stay high too. So the best advice now for you for keep them for this level where it is now. So and then talking about it, I will ask you, so after your diagnosis, when you be diagnosed with diabetes, how then you go about for manage the diabetes, because that very first time when you go for control, you said your blood sugar levels were so high, like up to 500. After that, when you came back home with this result, which way you did do am, which you do am while in Cameroon. Now we are talking about Cameroon. While in Cameroon, for manage this diabetes or for bring your blood sugar levels them under control, which you be do and which advice you be get them from your medical providers them.
Thank you. So when I be informed of the situation, they be tell me for make some lifestyle changes. They be encourage me say ma they do small exercises, and then they be also encourage me say ma they chop plenty vegetables, and they be also put me on medication, metformin, and they be give me an appointment for comeback. So when I be take the metformin and go back after the appointment, they be notice say the sugar level still dey high. So doctor be tell me say in that case they need for put me on insulin so that they go bring them down to a level before I'll fit then continue with that glucophage. So they be put me, yes, they be put me on insulin. So I be take insulin for quite a while, and then after some time I be constantly the check them, they do the reading. But it was not easy because even at the time I know they get the glucometer where they use them for check the sugar. So
the blood sugar meter.
yes, I be need for the go for hospital, and each time because doctor be say for the start I need for the check am 2 times a day. So check am for morning, check am for evening. So I be need for the go for hospital. Each time we be go check na 1,000 francs. So at least I be need for the spend 2,000 every day on that way. Be easy, and at times you go for some of those health centers or hospitals they no be get them. So now the nurses they be get their private on them. Where at times they will use them for you, you pay that money. So one of the issues where I be face them it be for the check that sugar level for know how it be day. But fortunately, after a while the sugar level it be go for down small, and then doctor now be say, all right, I feel leave the insulin and then continue only with metformin. So I be now leave the insulin, I continue with metformin. But at the same time, I feel say my family too, they be contribute so much for me for regain my health, because I be need for do some small relocation. Like I said at the time, I know we don't get married. So my family they will be based in Boya. So they be advise me say ma go for Boya, go be with my big sister where it will be being a nurse where they will help me. So they be do much. I mean, I get one of my mommy too, not only one, my mommy then for Boya. Mention mommy Jane for here, mommy Dinah. All of them, know the situation. So they be use diets too. I mean, every day they be make sure say, ma eat vegetable, I eat healthily, exactly. I eat healthily. And then when finally I become married to, before I was married, at least I be make me my wife to understand. My would-be wife at the time, my would-be wife understand say now the situation that I get them, and it be make me for understand say it be very ready for support me. And since then until today, it only support me, especially with regards to diet. So it could be make sure say at least ma they take my medication, ma they chop now the prescribed diet where you go help for put my sugar level low.
Down,
and it to be they see to eat that at least ma reduce that my drinking, because like I talk, it no be easy, and even can't reach right now. It not really be easy. So at
As a
least I
Cameroonian for that
struggle.
matter, as a Cameroonian for that matter, where you grow inside
Yeah, I
things,
grow inside, so it
yeah.
never be easy. Can't reach right now. So yeah, so
Mhm.
now some of the things and that way, I be doing for manage the diabetes.
Okay. So you talk, before I go, let me take this question from Afani Tikle. Afa say, what is your go-to lifestyle that helps you to keep your blood sugar levels in check? So maybe your state of mind, your diet or exercise, which be your go-to lifestyle where you go, where it help you, where you don't stabilize your blood sugar levels.
One thing will be my state of mind,
Mm-hmm.
because the information where doctor be give me the very first day I go hospital, it be pollute my mind.
Mm-hmm.
So it will disturb me a lot. So my
Mm-hmm.
state of mind, and my fiance at the time, it
Mm-hmm.
be make a man understand, say that one no be any problem. Say with type 2 diabetes, we fit reverse them, or even if we no fit reverse them, we fit keep them low by
Of
means of
course.
exercise. So it be
Of
make them to
course.
now. I be engaged in exercise. So most occasions and for morning time, I be dey wake up and make sure say I run for about 30 minutes or so
Very
before
good.
I do one go for school. Then
Mm-hmm.
my school to be get small walkable distance where I be either used to use bike for go to school and for come back. So one
Yeah.
way I be do for check am too na say I be make sure say at times, either when going to school in the morning it be a little difficult, but during the day, because with school too forget bikes them at times for come back used to worry, because students then too the one for take bike and all the like, and bike people go like for carry students, then because with students they fit carry 2 or 3 where they will get more money, but when they
Mm-hmm.
carry teachers they no fit double them.
Mm-hmm.
So one way where I be doing, I say when school close, I the worker come back for house, maybe worker with colleagues them, and we they take about 25 to 30 minutes to for come out for school, come back for house. So
Mm-hmm.
it be really help me. So exercise, it be help. A change of
Mm-hmm.
mindset with the
Mm-hmm.
encouragement from my wife, it be help.
A
And
positive
of course,
mindset. A positive
positive
mindset.
mindset, correct. I
Mm-hmm.
be get for maintain a positive mindset for
Yes.
talk to no, that one not be any problem. I feel manage this sick,
You can
and
navigate your way through it. Yes.
correct, correct. And then that diet too. So now the three key things in that way, I be doing for keep going with the diabetes.
Okay, thank you very much. Brother Valdo Akwese, hello, good afternoon, our host and our guest. Thank you very much, Brother Valdo, for joining. We are live. I will talk about diabetes management. We'll get our guest speaker where he share with us his experiences. Then, okay, you talk say for Cameroon. Why treating you? They be use metformin, they use glucophage, and then you use insulin for treating. Because most often we come to discover say the medications and where they get for Cameroon, sometimes you fit even go like to go buy your medicine, or you fit go buy even this insulin, but you know if you get them. Why? Because they be short in store, or maybe that particular mark of that medicine where you dey use them, be available. So you will ever experience that kind of situation. Say you want go buy medicine, better, and then which you be do in that place, so that people the way they get diabetes for Cameroon, they will also learn from it because you did it and it worked for you.
Correct. Very important question. In fact, now one of the things I be get for come for there on the challenges then where I be get am. One of the greatest challenges and where I be get am for this sick, it be been a forget medication. Both
Okay.
both the insulin and the metformin. I
Mm-hmm.
remember say for the insulin, and also to get a diabetic specialist, a
Mm-hmm.
doctor when a specialty that, because most of the doctors in way they go see them are general practitioners them,
They do
but I be needed
everything. They do
everything
everything.
exactly.
Mm-hmm.
So when I be go for Boya, my big sister when a nurse, he be tell me about a diabetic specialist where he be the common and limbe, they come for General Hospital for Boya. And if they come now only once a month.
Can you
So if they
imagine?
talk, yes, just once a month, and that once a month, the population enough to be easy, and it will be a first come, first serve.
Of course.
So I will be new because I be the work for Ngokutunja, I come that side come for Boya. I begin now, I come, they tell me, say they get some sort of a diabetic community. I need for register for them first because the doctor be say if they come there once a month. So I think can register for there and then I come for consultation. So that doctor, now the person that I be see, but like I tell you, it no be easy for get access for you because he be the commodity and limbe come for this.
Yes.
Exactly. And then population it be too much. Then even when he come now, he don't check where you the wait sote before you attend one reach. When he check now, forget that medicine was another problem. You know how the system be. So I don't know whether it be now because I be there new for that community of diabetes patient for Boya also. So when I be go say for pharmacy, forget them, they be tell me say medication don't finish in no day. So I be there for some time without medication and waiting my family be get for doing. I say they be get now for resort to herbs like this aloe vera, they make and put them for Patagian for me. Bitter leaf that they wash and give me the water, say I drink them, you know, and other herbs the way they give for help me for calm down the situation because the medication no be there. But what's the way it will be surprising. I say other people they go, they come out with the medication, they get the medicine, yes, they get the medicine. But I can notice and say the one it no be peculiar only for Boya because even when I be go back after my sugar level be don't normalize, where I now go back, travel back to my base fund up, forget that medicine again, it no be easy. Sincerely, I know be get that medicine from the no one time because all the time when I go for hospital, the time say, you know, they first tell me to say they get a community for the way they meet up once every month and for Wednesday. That Wednesday, it not be possible for me because I be the teach for Bali, where they far. So for commodity camp, it be really the worry. So it be there like you need some more connection before you figure that medicine from the next.
Yes,
exactly.
I
So it was really difficult, but fortunately, I be get a family sister where it be the work for the health center for Bamali Fondobde, Adele. So I be explaining for you. So you tell me, so all right, they used to get her. So through ye, it be the beg the pharmacist, it be the beg the pharmacist for they then get some of the medication where he go call me, ma I can't take them. And then for Balikumba too, it not will be easy because the pharmacist too for they even know the patients the way they be diabetic way when it come to it preserve for that it preserve enough for them.
Of course.
So yes, so but fortunately again, the pharmacist will be now my colleague, a wife.
Wow.
So when I be explaining to it will be filled. So when it come, it is ration the thing to give me small one. But I want to be sincere for saying it was really difficult getting the medication. So now those helps them and everything with my wife, two friends and others, whenever the sugar be go that very high, they make an now forgive me for balance up when those medications they no be available.
Okay, before I talk to it where you talk, I get a question from here from our brother Valdo Akwese. He just joined with it now. So maybe by the time when he join, when you don't already do your introduction, so he missed out on this part. He asked you say, at what age were you diagnosed with diabetes?
I say I will be diagnosed with diabetes at about 28.
Okay.
Yeah.
Okay, but Valeria, your question has been answered. And then I don't know if you can read the comments because Crystal Zone it requested me to read it because you don't write something, they requested me to read it.
Ah, okay. I know the C yet, but I'll look them. Yeah. Okay. It's a live now connection and are really true.
No, before that one, I think a little bit higher.
Okay. Maybe I'll look them after. I know if you see them.
See if I can see. Okay, it's a part. It's a, okay. Let me read it for you. It's
Okay.
a it's a part though. I feel confirm say you did really try as I see your struggles during my visit. You just did lie low in the middle of family living. Keep it up, bro. So it don't appreciate you for show how far you don't go because he see how you struggle about it. So I don't know whether you
Thank
get
you.
anything to add on that.
No, it talk na true. Like I tell you, family gatherings, them now those opportunities where you not only share discussion, but you share meal, drinking, and all the like. So it was
Mm-hmm.
not really easy. And
Mm-hmm.
say what kind of drinks them for here, they know they like for Cameroon way another big bottles and for any small bottles and way that Guinness or any other thing you feel takes up even 6, 7, 10. A day they say
Mm-hmm.
you never take anything. So I dey really ABC I be really struggle hard, for control. I'm leaving myself maybe to 2 or 3 bottles, but it was not easy. When you see every other person, they really chop very well, enjoy drink, and then it dey say in a go. So I mean, yeah. So I appreciate
Okay.
you for that one. We be vigilant.
Thank you very much. Thanks very much for
Yeah.
that. Okay, so let me just try for add a little things about which way don't talk about the medications and what they use
Yes.
for treat diabetes, so that if you catch your breath also a little bit,
Yeah.
and
Yeah.
then the audience they understand which these medications they mean. You don't talk
Yeah.
you talk about glucophage, you talk about metformin. Actually, metformin and glucophage are the same medications. They now just the name is different. It's just like paracetamol and efferegan. All of them they are doing the same thing. And then which the metformin you do metformin an oral medication where it means say metformin you dey take metformin through your mouth, and it dey help for manage diabetes, especially people the way they get diabetes type 2. The thing wey metformin dey do na say metformin e dey go help your liver wey na your storage part for your skin. You know say when we chop our carbohydrate dey enter inside our skin, the reserve of this sugar e dey go be stored inside our liver dem. For the moments the way chop need dey come inside, or for the moment the way you need energy, this your liver e go release that sugar back into your system so that you fit get enough energy and your blood sugar levels then go high. So metformin in this case, when they treat person wey e get diabetes, they dey give am for that person so that it go help for block this system, so that your liver no go dey easily release sugar inside your bloodstream dem for cause you high blood sugar levels. Another thing wey metformin dey do as an oral medication, I say metformin e dey help for stimulate your pancreas, wey na that organ for our skin wey e dey carry that cells wey dem dey call am say beta cell, wey e dey produce insulin for help bring our blood sugar levels dem down. So this metformin e dey help for stimulate your pancreas, for shaking your pancreas. If your pancreas be dey sleep, e dey help for wake you up, say make you stand up, produce more insulin, because the sugar levels dem dey for here dey high, so that the insulin e fit be used for reduce your blood sugar level. Then you come now, you talk about insulin. Insulin na a hormone, like I don already talk, e dey be produced for our skin through the beta cells. But then if they discover and say you are a type 2 diabetes patient, it means say either your insulin or your pancreas e no dey produce enough insulin, or e dey produce insulin but your skin e no dey fit use this insulin fine. So the thing wey dem dey do na say dem dey give you this extra or this artificial insulin, wey you dey fit take am na only through injection. It is only being injected. You no fit take insulin through your mouth. You no fit take the needle, you press am for your mouth, you swallow am. No. Why? Because the stuff wey e dey inside the insulin, if you do am like that, e go be broken down by the acid wey e dey for your stomach, wey e go help me this insulin no function well. So insulin e only be na injectable. They no fit take am through their mouth. And insulin e own function na for help directly for bring your blood sugar levels dem down. So I say make I explain that one because I don't talk about the medications the way it is, so that our audience feel know where these medications they mean. So if you hear the name glucophage or you hear the name metformin, no say that the same medication. Now just say the names and change, just like you get Dafagan, paracetamol, efferegan, all of them they are same. Just say the names they don't change. Now, Pajo, coming to you from your challenges the way you talk, and you get a challenge for medication and you talk about education because you were not being informed or well informed about going on with your diabetes management. Apart from these two challenges, any other challenges that they will be face them again while managing their diabetes?
Uh, I feel say the challenge where I be face be how for limit the consumption of alcohol. Like I tell you, it will be na one big thing that for me.
Mm-hmm.
How for limit that consumption of alcohol. It not be easy
Mm-hmm.
because even where I be the stay fund up
Mm-hmm.
just by me, my landlady be get bar. So if beer no day, wine me will be there. We
Shagide, Shagodua.
I feel drink. So that was a very big challenge for me. Then again, another challenge be another chop because like I
Mm-hmm.
tell you, at the time where I will be diagnosed with the diabetes, I no be done married.
Mm-hmm.
So when I become back now for up, I will be all by myself again for start cook that vegetables and all those things them all by myself. Will be easy. So time
Mm-hmm.
and again, I will be forced for go back now for a restaurant, and you know how a restaurant chop the day back home.
Sashi,
They
yeah.
exactly, and then those
Mm-hmm.
tashi chop them too. So it not be really be easy. So
Mm-hmm.
now some of the other big challenges, and that way, I be getting for manage the sick. Then
Mm-hmm.
I don't first talk about a specialist. It not be actually be easy, forget somebody way it be knowledgeable in diabetes the way you did for
Mm-hmm.
really educate me.
Mm-hmm.
So it will be a little difficult for me when I be come back from Ndop. Now true Abuan Komod Boya, this specialist, this doctor, because of the connection with my sister, he be give a number for me. Say
Mm-hmm.
ma they call it once a while, tell it how the situation be there, but calling over the phone and saying a
It's
bit
different.
different than physically seeing you.
Sure.
And then yes, and you even know, I mean, I not feel remember how many times they be ask me for go do this A1C. I mean, I did compare with what way it don't happen since we are there for US because I feel say after
I was coming
every
to that. I was going to
yes,
come up to that. Yes.
correct,
Mm-hmm.
correct.
Yes.
So
Mm-hmm.
so that was also a very big problem for me.
Mm-hmm.
Just
Mm-hmm.
stop.
Okay.
All right, sorry, my alarm the ring. I'll struggle to stop them.
Okay, it's
So
okay.
yes, it has been also a very big problem for me. Yes,
Okay.
yes. So getting that complete, diagnosis for know how my system they inside, even my vision, because diabetes they affect vision and all the life for know how and not be really do a proper check. I mean, I
Yes.
don't yes, and I
Mm-hmm.
not really remember when. I not say about one or twice back home in Cameroon, they be send me for go do that A1C. But when
Yeah.
I become, they'll just tell me, say, okay, you don't read now this, but they not be give me details about every
You
other
know the
thing on my
understand
system.
and then they tell you, but then they explain and for
Yes,
you to understand where to be diabetes
exactly,
and how you feel manage and for bring and for good
exactly,
results. Yes.
exactly.
Yes.
So that was a really another big challenge for me.
Okay.
Yeah,
That's good. Thank you very much. Hello,
it's okay.
Adam. You're welcome from Poland. Thanks for joining, Adam from Poland. Thanks for joining.
Yeah.
Yeah, so for all those who are joining us now, we are live with our guest speaker all the way from the United States of America, a Cameroonian based American. So he is telling us about his experiences while managing diabetes in Cameroon. So any question where any person get drop your questions for you. If you want to know anything about diabetes, drop and so that he will answer your questions. And now you moved from Cameroon to America. So how is it in America? How is it about your health? How is the diabetes management? Which it happen now with your system when it concerns diabetes management? Because now you don't move from Cameroon to America. So how is the treatment there?
The treatment for here, not true say healthcare for here be expensive, but
Mm-hmm.
at the same time, I feel say the treatment be far better.
Mm-hmm.
Now, true, the management in Noba really be easy for me for here because of a number of factors.
Mm-hmm.
So I dey still take medication. In fact, when I
Mm-hmm.
be come here, I be get another family brother for Cameroon where he be also connect me to one natural product, the
Mm-hmm.
STC 30, where I be taken to couple with food nutrition where my wife be they put them in place. So I be
Mm-hmm.
really feel better. And here now I get a personal doctor, a specialist, where he be
For following up.
specialized, correct, where he dey follow me up every 4 to 6 months. I must go see. In fact,
Correct.
unlike for Cameroon, where maybe I be fit dey go hospital now only when I know the feel better. But for
Mm-hmm.
here, whether I did better or not, on the day of my appointment, I
You
need
have
for
to be
go
there.
see
Mm-hmm.
exactly. And
Mm-hmm.
here, he no limit am only to that diabetes because he understands say it dey affect many other. So at times when they do the A1C and all the rest, he check am from there. He dey be able to regulate my medication for
That's
know
it.
whether I feel reduce or increase the dosage, and
Thank
also
you.
whether for add another medication or not.
Thank
And
you.
I feel say one of the good thing we I don't enjoy so far for now the fact say since I come for here, I never be able for take that insulin again as I've dey take am back home for Cameroon. So now only medication where I don't dey take am for here, that glucophage where it
Mm-hmm.
don't dey give am for me. And
Mm-hmm.
most of the times, the end at that. So I don't do even eye examination for
Mm-hmm.
make sure say my eye, my sight, everything is there
Cannot be
correct. I mean,
destroyed.
yes,
Mm-hmm.
I mean you to see the test whether they carry on for you, it include your complete endocrine, everything, you know.
Mm-hmm.
They do they go touch under my feet with their to see whether they feel anything or all the like. So
Mm-hmm.
so far, I get one specialist now where now my PCP where I dey see every after 4 to 6 months. This May,
Mm-hmm.
I be last see, I think for November or December, if I'm not mistaken. So I get
Mm-hmm.
appointment for see again this May. So
Mm-hmm.
this far, just with the metformin, the nutrition, it dey go. I want confess say the one way it don't be a little difficult for me. Where I don't slack for day for do am na exercise.
Okay.
And yes, I don't slack for exercise because of my work schedule.
Mm-hmm.
I dey
Mm-hmm.
comot my work they start very early for morning, and with picking them. Now one of the other big challenge that because for Cameroon maybe I be fit come or work around, say picking the day around they be safe, but for here fit live picking them that way. So
No.
with all of that, so I don't slack for exercise, and that one asabi, yes, I need for Adam for complete that you know
Okay.
that
Ma read,
schedule.
ma take this question from
Yeah.
Afat Nicole. Afat say, who say white man country no fine? See how their health providers are great professionals.
Yeah. Yeah.
And
So
then Crystal Zoom say, wow, that's great. Man, the lifespan the increase for Oyibo country, no be lie. For sure.
yes, no be lie, because I even remember say there was a time where I be get something like eczema for my head, and I be go this time I be go see a dermatologist. You know, for
Dermatologist,
here,
yes.
yes, the system, the medical system for here now one way. I mean, it be connected everywhere. So
Mm-hmm.
irrespective of the hospital where you go there, once they put your information, they see your medical history, everything. And when they be open them, easy and well, I just need a medicine for the eczema or so, baby, look at me, say, no, you be diabetic. So this particular medication, I know figure for you, you need
Because it
for
will
go do
interrupt. Mm-hmm.
instead I need for go do A1C again, bring them,
Mm-hmm.
me see the results and everything before it place me for a particular medication. So I mean, it be here, whatever complaint where I get them, immediately I go for hospital, they must check them for make sure so they see my medical condition. And at times they
Mm-hmm.
go request me for do a blood work before they will be
Mm-hmm.
able to free administer any other medication where get anything for do with diabetes. Not like back
Mm-hmm.
home where maybe if I begin an eczema or so, you just go doctor go just give you the medication but for year. So those
It's
are
check
some of
up
the
for you.
differences
Yeah.
exactly. Yeah.
Yeah.
So it help. Yeah.
Okay, ma take this one from Suzanne. Suzanne said, wow, 1,000 francs per check up. That
Yeah.
is expensive. So if you have 4 or 6 point day curve, it means that you get to pay up to like 6,000 francs per day. This
Correct.
is so much the government needs to step in.
Yeah.
This is job where it took it make me for come for actually question. It means the government needs to take in. So around the time where you will live with diabetes for Cameroon, you will be subsidized or everything where you will do and be the corona for your pocket, or you will get maybe NGOs the way they will help you for your medications or for the check your blood sugar or everything where you will do for manage your diabetes, you will do it personally.
Everything where I be dey do it be been a personal. I not be get any subsidy from anywhere. It be from my pocket. And it not be really be easy for the take that blood sugar because sorry for the do that testing, for the prick my finger all the time do that testing because the way my blood sugar be there, the doctors they be need that ma they do ma be continuous in doing that almost every day.
Mm-hmm.
Morning, evening. So just imagine, say for 5 days, if I begin for Duam, that is about 10,000 every
Most
week.
yes,
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 when I plenty money where I not be
of
fee
course.
afford. But I
Mm-hmm.
be fortunate because when I get these difficulties, my big brother where he dey for US here, he be tell me say no man, no bother for that one. So immediately he be buy glucometer machine for here and then buy so many strips. He send them for me for Cameroon. So that one
Mm-hmm.
will really help for save me because with my personal glucometer now and all those strips, I will
You will
be
fit
able
follow
now
easily.
for the take my blood sugar, miss myself now every day, morning or evening. I no begin no fear because it be really buy plenty of the way. If it take me more than 1 year.
Okay.
So we be send them no say by the time I'm finish, ma let you know so that he go buy someone again, send them for me. Some of the strips, because that particular glucometer, now one way no be there for Cameroon.
Okay,
So
so
they
if
strip
only for the
them,
same.
if you need for they send me the strips. So now that one now I be use them, but I no be get no subsidy. If no be intervene, I'm not sure say I for be able for the cope with that, 10,000 twice a day for the bring myself, forget the sugar level. Yeah.
Okay.
No NQ.
Okay. Ma ask you this question before I will take a comment where Afa drop and down. You
Yeah.
talk of for go do this test because you mentioned the fact that you be mostly gonna for hospital for go do the test away it be cost about 1,000 francs CFA.
Yeah.
And then up to that moment when you wait till your brother send you all these glucometer and that test tubes them because we are talking about the challenges that you face with
Yes.
diabetes in Cameroon. So what if it stop you from buying your own machine, from getting your own glucometer? Now say this method they not be available or now say you not be get the finance for you for go buy this method until now your brother be careful send you this machine.
A very excellent question. That no be say I be lack the money for BAM, but for see the glucometer it no be possible. You know,
Okay.
for I no be fit get I no be fit see am from Bali, I no be fit see am from Dop, and
Mm-hmm.
for Bamenda, now only for
Mm-hmm.
regional hospital where they get, I think some NGO they get a section for day where some NGO
Mm-hmm.
the way it is supply them and it not be available all the time. Because I
Mm-hmm.
remember say even some one time they were the last time we my strips them they be finished before my brother one struggle for send them. I be need for the take the sugar level I not be well, I be admitted. So I will be forced now for the use now those nurses their own way that they pay me. Sorry, way they pay that one
You pay
thousand.
them.
Yes,
Mm-hmm.
I remember say my wife go for that place for purchase some, it not be available. So
Mm-hmm.
yes, it be difficult. And again, the sensitization, no, be that sense to self say, now for go buy
You
your own
buy
self.
am.
Yes, it
Yeah.
not be even come self for me, say, ma, even look but I think not only for Bamenda, for regional hospital, where you be fee get them. And
Mm-hmm.
it not be been at all time for them because now some NGO, if I'm not mistaken, it be they supply them because when they be go check, they say it never be available. The one way they day they don't finish, so now only after we will fee come back again for car find them. So it will be difficult for get the machine.
Okay, so actually, you not getting the machine one because you don't be even like think about it, so you feel
Think
buy them by yourself. And by
exactly.
the time when you even start thinking, so you feel buy them by
Yeah.
yourself, the machines they were scarce.
In no
So
day, yeah,
there's a problem of scarcity getting this machine. So like the
exactly.
challenge is how people when they get diabetes for Cameroon. I believe
Yeah.
say most of them up to date they still face those challenges. Then
Yeah.
yes.
Yes, there is still face them, and you know with system too. Even some of those health centers them, they not get their own. So those nurses them, now their own back pocket that they
Yeah.
use now their personal own them now for do that thing for you, and then that 1,000 or so they go
You
now
go
for
for
their
their
pocket.
pocket.
Exactly.
Yeah.
So it's
Of
really
course.
difficult, they and none of them they know even advise you. You know if you come because of that, they know what you again. So you know if you even advise you say
So give you
no, they
correct
mention
results.
this. So yes, it they sell them for you. You feel go buy your own and all the like. No, the one time you they use now that even when you come hospital, you say you get your own. They know you feel happy for you get that kind of information because they know
Mm-hmm.
that money that way they lost them. So
Of course.
yeah.
Okay, I got a question here from Suzanne. Suzanne said, I have a question, sir. Have you ever had a hypo or hyper at home? How was it managed? Back, I think, Suzanne, you mean back in Cameroon. So for Cameroon, you be ever experienced maybe low blood sugar levels or high blood sugar levels? If yes, how you be managed and why in Cameroon?
Yes, not only high sugar level where I don't get them, and
Mm-hmm.
I don't explain say the way I be manage them now through medication, through exercise, and
Mm-hmm.
then through diet, and then I be
Mm-hmm.
also incorporate local or traditional medicines like the use of aloe vera,
And
like
bitter leaves, you said.
uh,
Mm-hmm.
that water for bitter leaf. Yes,
Mm-hmm.
and so other kinds, small country, mixing them way, other friends, neighbors, and all the like, they be, show 'em for me, so if you use them.
Okay. Okay,
Yes.
Suzanne. So I hope say, Suzanne, your question don't be answered. Our brother not ever experienced a hypoglycemia.
Mhm.
The only two way be the experience and a hyperglycemia, and where it don't list the thing the way it be do for bringing blood sugar levels down whenever it experience all these situations. So, Andrew, if I fit ask you from your experience where you don't talk about you managing diabetes in Cameroon and you managing or living with diabetes now in America, what do you think say what Cameroon, how will we better the knowledge or the management of diabetes for Cameroon? How will we do with diabetes if it be better managed for Cameroonians? Then what do you think so if we do? Seeing that you there for America, you don't see, you don't learn. So which knowledge about that will feel acquire them and then will implement them for Cameroon so that we feel better manage diabetes.
Thank you. I feel say one of the very first thing we will feel do now sensitization.
Okay.
We need for sensitize the public the way you did do.
Okay, I'm talking about sensitization. What to feel sensitize them about? What to feel tell them about the sensitization programs then?
if we tell them about lifestyle changes,
Mhm.
lifestyle changes, me the,
Mhm.
yes. Then we also tell them about for also check, genetics. If any family member, they
Mhm.
will get that diabetes, if
Mhm.
fine for start take precaution. And
Mhm.
I think say for this sensitization, it also good for let people understand say once a while it just be good for go consult for know about your sugar level.
Mhm.
No only wait until when you start feel those symptoms and before you want go hospital. Sincerely, I not be ever think about that because the environment where will grow for then I just environment for Cameroon. Now one way say you dey go hospital only when you be sick.
You sick. That is it.
Yes,
Mhm.
yes, only when you be sick. So if you just go do a normal check. So we need more diabetes educators like you for
Mhm.
educate with people. There are many people in Cameroon where they live with diabetes, but they no sabi.
That
They
is
no
it.
sabi
That
say
is
they
it.
get that diabetes. Yes,
Mhm.
but they live with them, but they don't know, and they continue in their lifestyles, maybe drinking a lot, not doing exercises, eating anyhow, thinking say maybe that they live a good life.
Mhm.
Meanwhile, it only help for worsen their health situation. So I
Mhm.
feel say if this sensitization, if it be done, me with people they understand, it will really help most of them for know their diabetic condition and see how they feel
Mhm.
better manage them.
Manage am. Mhm.
And then one other thing too, I say if we get more specialists them,
Yes.
doctors the way they specialize for that particular field for
Mhm.
almost all the, I not say it be difficult for talk about subdivisional, but almost all the divisional headquarters them with good laboratories put in place where people they feel be able for check their health situations them. That one too
Mhm.
will be very nice. And then
Mhm.
medication. If
Mhm.
if the government will make it possible for where all the health centers them they get medication where it be readily available for the population, it will help
Yes.
a lot because sincerely, like I tell you, that medication for diabetes, most health centers they not get them. And even
Mhm.
the few them where they get them, they
The
ration them.
expense and it
Not
will
only
be
expensive,
expensive.
yeah, it be expensive, that they ration them, and then it's like you must get connection before you want get them. Because so
Mhm.
many people are like so many people they get that when they talk for you, like somebody where I don't live with them. When people they tell me I discuss with friends or other family members, they give some kind symptoms them. I just know immediately say na signs and this for diabetes. But you see that they live with them, the no man no know.
Thank you.
So so if our government, if we help for put in place things like this, or we get even NGOs them.
Mhm.
Yes, if we get people there, if we create NGOs, then where if we also help and then provide even those machines. If people then will local people because those machines them now about 30,000 for Cameroon.
Mhm.
I remember
Uh-huh.
say, yes, a few months ago I be buy some for a friend where he be complain. So I be just bam for Cameroon there through one of my ex-student when a nurse for regional hospital for Bamenda. Now you go
Mhm.
get them. Then I send them for. I say you feel be able to test your sugar by yourself. So we
Mhm.
want a situation where must get that connection because if I know that my
Of
student no be there for
course.
day, it
Where
will
you
be
fit get that
difficult for me for
freely.
get them. Yeah, well if you get them
Yes.
freely. So
Yes.
now through
Yes.
that my student where I pass get them for hospital day from here since it be next for day. But let them make them for where you feel get them freely and you be
For the
able to test
pharmacies, then,
yourself
if you go
for
for
the
pharmacy, you
pharmacy.
get your money, you fit easily buy
You feel
am.
exactly so that you know your health situation. Yeah.
Yes, yes, yes. No, that's very correct. Let me
Yes.
take this comment. You say, travel with Gramsci, they say, we really need this kind doctor, the more especially on basic home first aid. So
Yeah,
talking about you, so we need this kind
exactly.
of knowledge. Yes, for
Correct.
sure. Thanks
Yeah.
for joining Travel with Grandjive. Yes, so actually, a really big challenge for managed diabetes in Cameroon. Seeing the issues the way you don't talk and like somebody where you don't live for Cameroon, where you don't experience the Cameroon diabetes for Cameroon. Because before you want travel to America, you travel with insulin along with you to America. But
Mm.
now you live freely without insulin. Why?
Okay.
Because of the medical system, how they don't take care for you, they control everything for self, they bring your blood sugar levels under control. Not only about that, they educate you about your lifestyle. So you get to
Yeah.
change your lifestyle, you get to do exercise, you get to eat healthy.
Yeah.
But now education in this way will lack for Cameroon. Where it means say, if what people there for Cameroon, they actually get this education there, it means that they will definitely bring their blood sugar levels there under control. Maybe
Correct.
just once or twice, if you then go
Yeah.
for hospital to go
Yeah.
do all these checkups there. So we
Correct.
really be lacking in that. Now, why that way? You and me, and together with our audience, we get for help for push this message about diabetes awareness to our community. And now the more reason why I bring you for my show because you are speaking from experience. Nothing when
Yeah.
you did go through, nothing when you did face some. So if I say once in a while we come out, we talk about diabetes, so that people there, especially for Cameroon, our focus now Cameroon.
Yeah.
Even though diabetes now a global something, but our main focus now Cameroon because we are from Cameroon and we know how people there that is struggle with diabetes for Cameroon. So I really appreciate you for being here, even though we are not yet finished. Let me read
Mm.
this for you. They say, Nebuchadnezzar say, how can you advise the less privileged who take infusion from a medical store to the street without knowing their diabetes status? I don't know that you get the question.
Say again, please.
He said, how can you advise the less privileged who take infusion from a medical store? So they
Mm-hmm.
don't get their medication from a medical store on the
Oh.
street without knowing their diabetes status. How you feel advise this less privileged them?
Now true, it really be difficult because we know the situation back home for Cameroon. But again, I feel say we people then for Cameroon, they just need for prioritize, because except things that don't change small, I not say consultation for Cameroon now about 600 francs by the time we have
Mm,
in Cameroon. Maybe if you don't
mm,
there now, if it be like 1,000 or so. If
mm,
maybe you feel drink one bottle Mimbo now in a 1,000 without any problem, or
mm.
go do something, your health be more important than anything. So
That's it.
again, the only
They say
thing
health is wealth. Health
is
is wealth.
wealth. West.
Mm,
I think the only thing now continuous education for those less privileged because they get small money 1,000 not just for put them if we prioritize you put them first place the fee be able for raise them and like
mm,
again where I be say if we get NGOs then too where the fee help with people then for like sponsor where the fee go do free test, or even if we government them, they feel like encourage sometime, or the person where he asks the question, if where they were just as an individual, somebody complain, or you say you feel support somebody with 1,000 francs or 600 francs to go to the hospital for do a check in order for no to take this medication, then for streets where you never be able for no, you go feel
about
help
their
that
situation.
that,
Yeah.
that aside, I don't know where to where I feel talk again. I think that just sensitization with people they need for sensitize for be
Yeah.
sensitized. Yes.
Okay. Okay, let me take this question. Suzanne say, host, please, can you ask our guest to answer my question? It might save the life. Suzanne, which question about the hypoglycemia and the hyperglycemia? He answered the question already. Maybe you will know, Suzanne, if that question for hypoglycemia and hyperglycemia, He answered them already. He said, actually, you know, ever experience low blood sugar levels. Now only high blood sugar levels where if they experience that, and which way if they do for a high blood sugar levels or bring that under control. Now for you for the if we be very careful for which way if the chopper, if they do exercises and African medicines them or African remedies them like for drink aloe vera and bitter leaf water, it be the help you for bring the blood sugar levels them under control. I don't know if that I question that. Okay. Yesterday, my mom went to her tenant who has a drugstore in our street. Before I realized she was about to put my mom on drip, I warned the girl very badly because she once said her fake drugs. You don't hear, you read that? But
Ye- Yes,
that's yes. The first person we asked that question about that on that privilege, he said, yesterday my mom went to her tenant who has a drugstore in our street. Before I realized she was about to put my mom on drip. I want that girl very badly because she wants to sell her fake drugs. Can you imagine?
yeah,
Just
yeah,
imagine now say maybe like a diabetic patient that
yeah.
and then you the one put it drip and when the
Mhm.
drip go be involved in glucose. Just
Yes,
imagine how they kill lives there for Africa. Now why that way as a medical practitioner, you get to first know the history of that person before you prescribe
correct,
any drug. It be very
correct.
important. Know the history. No be say some person go come for your pharmacy, he say he wan buy paracetamol because he get headache, you just give it that paracetamol. It is wrong. We have to sensitize our public because paracetamol no be na everybody suppose for take paracetamol. People then they will maybe they get problems with their kidneys them. These people maybe they're not supposed to take all these drugs like paracetamol. So it's very important. Go to specialists, even when don't go to a local drug dealer to buy your medication. Go for hospital, make them check you even before you want buy any medication. No say you don't be checked and you don't be diagnosed with that particular thing before you go buy that medicine. I believe that one thing this way it really kill or affect people them back home in Cameroon because
Yeah,
when you get headache, you just go to the shop and buy your medication without even taking consideration of other health issues that you are
yeah.
facing. So, Pajo, I don't know whether you get any contribution about this comment where our sister drop her waiting happen with mommy yesterday.
Yes, I think you don't actually talk all. Now, one of the big problem that we get them back home, say you fit get those drugs them anywhere. For year in the US, there is no way except now what they call and say over the counter drugs and where they know say that one it no fit get any problem. But most of the drugs it must be prescribed by a medical practitioner.
That
But
is
for we
it.
for they that and then one other thing too where you see this thing they over occur for them and say we medical practitioners back home, be they nurses or doctors, they not be liable, like for this for here, each medical practitioner he want protect a license because he know which way it mean if that license be taken away from him or her because of a medical error.
Error.
And now why that way they be very careful, they be meticulous in whatever they are doing. And
That's
as
it.
we talk, plenty of people them back home, they die because of medical mistakes caused by the nurses and doctors. And who cares? Nobody
Nobody.
talks about it. Yes.
Mhm.
So we face that if we be the way the government to fulfill regulate that sector so that the medical practitioners they may be accountable if a lesson it be said on 1, 2, 3 and the news spread the population know we feel say small adjustment it go be and where it go help
Mhm.
to save people their lives the
That's
way
it.
it did for this side. Yes,
That is it. That is it. I think that's an area that we really need to work on, especially
yes,
for Cameroon. Not just going to the shops and buying medication, no, but get a prescription. Some okay, so local ones, but not before drip. How person
yes.
go can't complain about illness? You want just give it to you. They give and drip on under which grounds? It's very wrong. It's not
Very wrong.
correct.
Yeah.
Yes. It's very correct. Okay, Divine Favor, greetings to all. Thanks very much, Divine Favor, for joining. You're welcome. We are welcome. So, if any person you get any question about diabetes, we're here with our brother Pajo from the United States of America. He is a Cameroonian, a diabetic patient. He is going on with diabetes type 2. So, if you get any questions about diabetes, ask him because he will be speaking from his experiences as someone who is living with diabetes. So if you get out there where you self you struggle for with diabetes, but you don't know how to navigate your way for get good blood results, you fit ask your question so that our brother, if he help you for talk to when he did do where he help you so that you too you fit try those things the way he did do. When I talk about diabetes, Fajo, I always talk say diabetes not be something when only you supposed to do. When you
Yeah.
are managing diabetes, you need, for example, you need your doctor, you need your dietitian, you need maybe an eye specialist, a kidney specialist,
Yeah.
even your family around you because they help you for make you come out from that, even mentally and any other how that they help you. So what do you think about this aspect? Is it good for you to just stay by yourself and manage your diabetes, or if find something you meet up all these other people the way around talk and how beneficiary way it dey?
No, I think you don't talk and I be don't earlier make mention of it. Say once you get that diabetes where you don't be diagnosed, yes, make sure say you frequently meet your doctor, you check. Make sure say you frequently take your blood sugar, you do your A1C if it be requested by the doctor. Make sure say you see a specialist for check your kidney function, how it actually be, and you also see an eye specialist so that they check your eyes and to see whether the diabetes they cause any damage for day. And of course, also make sure say you depend too on your family members and friends. Let them know you have it because at times they don't understand. Like, sometimes them I get a family friends or so. When I want visit, they'll ask me, say, well, you dey come when or so. They want prepare
When
something
dem cook,
sumptuous.
yes, dem
Yes.
wan cook,
But
yes.
I dey always make them for understand, say, well, it is so I be a little diabetic, and so my kind so when you make a then you understand and then they know the kind thing where they feel present and for you or they feel prepare and for you. And like in
Okay.
my case in particular, I don't get a lot of support from my family members, my friends,
That's good.
my
Mm-hmm.
wife. And right
Mm-hmm.
now, even the fact say I be diabetic now already an indication say my kids them they feel also can inherit them due to
That's good.
genetics. So right
Yes.
now, even at this young age, my wife makes sure say wait way that they chop for house. It mostly be wait way it be prescribed for me a diabetic patient. So
Mm-hmm.
it mostly cook now in line with wait
According
way
to you.
my diet as a diabetic patient. And then
Yes.
even the cooking them, it also make sure say it watch with the way that they chop candies, these sweet drinks, and all. Would struggle not be so they entirely deny them, but will struggle as much as possible. It makes sure that it limit them from them because probability they say the fee can get them. So
Okay.
with that kind of a support where you dey get them from your wife and other family members, your doctor, like I tell you, each time I go, when my doctor checks on time, he go say, no, okay, your kidney for this level, you need to go see this person, or because of your eye, you need to go see this other specialist. So they keep sending me from one specialist to the other, depending on the situation, each time where I go for my routine check. So the
Mm-hmm.
whole of that community, it helped me very well. And we feel say if we feel, get that kind of support too from people them back home, if they get that kind of support, it will help them very well for manage their diabetes too.
Okay, thank you very much, Pajo. I know say we dey run short of your time because you get to
No, no
go work.
problem. Yeah.
Yes, but I get one question from the audience, and then I go allow you conclude your part, and then we feel leave you go. So, ma ask you this question where our audience ask am. Is Betsy Butter meet Chinkwenta? He say, how you dey control your diet? Do you eat everything? Because for Cameroon, the diet is so restricted. So if they ask you say how you did do you don't manage with diabetes or Cameroon. So her question is how you did control your diet. Do you eat everything? Because for Cameroon, the diet is restricted. So you feel help we for enlightening us about this.
Yes, I thank you so much for that question. It be very important because for Cameroon, as you really talk, that it restricts you. So now one of the things that it even make me at the fear, things the way you don't grow up, the chop them and all the like, they start tell you say no, you know, get for chop this and that. And so I mean, you'd be depressed. But with regards to my diet, I did chop everything, but those prescribed things and where they put them for, where they give them for me, I did chop more of it. Things then like vegetables, things and where it contain protein, things and where it contain, all
Fiber,
those things,
fiber.
fiber, exactly,
Yes,
fiber. So
yes.
I eat more of those things. But
Mm-hmm.
every other thing, I feel take just a little of it, a bite of it, thing like cake. I feel chop just a bite of it. I take small. Any other thing, I go some place where maybe they fry and all the like. I take just a piece of it. I chop them. So I dey eat everything, but those things are where they help for take my sugar up and make sure say I take just a bite of them, just a
Mm-hmm.
small quantity, and then
Mm-hmm.
for those the way they be prescribed, I eat more of those things. So
Yeah.
everything I do take, yes,
Okay, so actually, for summarize which way you talk, for you dey eat everything, but which way say e no really be good for your diabetes. You dey practice portion control, wey mean
correct,
say you no dey chop them again very much. But then the ones the way they say you suppose to chop am wey say e be healthy for your system, na them way you dey really eat am much. So
correct.
thank you very much for that explanation. E be so good. And then one two of them for understand and just like our brother Pajo don talk, portion control. So
Yeah.
if you dey for Cameroon, you dey manage diabetes, and then say chop the way it get too much carbohydrate. Chop, but the thing wey you dey for do na say make sure say you chop na just a little bit, no over chop like you dey chop vegetables. Vegetables be nutritive and it be healthy for you, but when you go for chop the way they be unhealthy, limit the portion where you dey chop am. Chop na just small chop for day. She said, "Chai for Cameroon, diabetes they like say na life sentence."
Yeah. It talk not true. Yeah, they like life sentence.
Yes. Okay, Betty Butter. Thank God, Pajo don't explain and for we very well. Like Bessie, where he don't manage diabetes for Cameroon, he don't really tell we. And Betty Butter, the thank you also for your Pajo. He said thank you very much, Pajo.
Thank you, Betsy
Yes.
Butter. Yeah.
Yes, so Banjo, my last word for you before you leave. We are not saying you get a very busy day ahead of you. My last word for you now say, which advice where you get for our Cameroonian community? See and say you develop diabetes at a very young age and seeing the struggles, the way you struggle for navigate yourself through this diabetes, which you get for tell our public when it concerns diabetes.
Yes. Wait away. I want tell we public now say diabetes actually dey. It be real, but we fit fight them, we fit control them if we get the right knowledge and the right information.
Thank
So
you.
I go one for advice with Cameroonian public, say make they take their health very serious. Like I don't talk before, once a while, they fit just go hospital for do a checkup for know their diabetes status.
Mm-hmm.
And then may they also make sure say at least they do exercise maybe 30 minutes 1 hour a day,
Mm-hmm.
but it go fit help. And I
Mm-hmm.
also want to advise them for also watch on wetin wey dem dey chop am and
Okay.
wetin wey dem dey drink like alcohol.
Okay.
And I'll also need for encourage them say make they support the diabetes members and where they get them for their family, because the members they need their support for go through this particular condition, because like your past videos, and we don't always make we for understand say this diabetes this so it they affect plenty other organs and for skin way if you bring other complications and but when it be well managed, we'll also be able for live healthily.
Mm-hmm.
One also encourage, especially those in way the day here they watch, say we need more educators like you. And
Thank you.
so I dey encourage the Cameroonian community, say, make all of them, make they continue for the follow you because the education where you they give we for Facebook and YouTube concerning this diabetes, it be priceless. I remember say the once a month where I be used to go for the so-called diabetes education, them and all the rest, will they give small contribution, but here will not they pay anything, will they get free education from you.
Thank
So
you.
the only way where they feel help for support you now for make sure say this knowledge me reach as many people as possible by means of following you through your YouTube channel and subscribing in your YouTube channel, following you on Facebook. It's so amazing. We not get this education nowhere. So permit me for use this opportunity for appreciate you for the wonderful job where you did do for educate and sensitize all of we, you
Okay,
know.
thank you. My
And
pleasure.
yes, they beg my Cameroon people then say, please, me they check themselves, me they check themselves. Once a while, just go do the checking. Yeah. And
Okay.
say if they feel any small symptoms or say they feel some kind, even if it not strong, me they no wait until they sick strong. Me they go for hospital, go check, see, and then see how they start take treatment one time.
Okay. Thank you very much, Pedro. Thanks for your contribution. Thanks for everything, the knowledge we don't share and your experience. I believe say most of we don't learn from this experience. We don't hear how we don't talk. You navigate your way with diabetes from Cameroon. You come out of it for Cameroon, even though the challenges the way you face them without any complications of diabetes, even the most common one when a high blood pressure, you don't get them. Why? Because you be consistent on your diet and your exercise, your lifestyle, you do lifestyle changes. So that a very big message for all of us. And you talk say your diabetes, you get that at a very young age. Where it means say diabetes, if you catch any of we will there for your diabetes, more no say no be nothing for old people, them no. If you are living an unhealthy lifestyle and if you get a genetics factor, if person if your family where he get diabetes, no say you be likely to get this disease. So make we wash out just like our brother don't talk. More help us sensitize our public. And if you get a family member like which way it talk, assist that person for see say he navigate the way through this diabetes because mentally it is draining. Sometimes they just need some person for talk with them and then their blood sugar levels them they will go down. Remember, say stress it help for increase the blood sugar levels. So, Panjo, thank you very much for being here. And hopefully, one day we can be here again so that if you talk about diabetes again, share more insight about your journey so that we all can learn from you. Thank you more. Thank you again. Thank you very much. And have a wonderful day ahead. I don't know whether I get anything for talking again for our audience before you feel sign out. Then the floor is with you. Anytime you can sign out.
All right, Mira, thank you too so much again for the wonderful professional free education way they give way and permit me for also use the opportunity to for thank the audience, especially our viewers from Cameroon, because
Okay.
we understand their how difficult the environment there and even their network service, how very shaky it is. But I
That's
mean,
true.
seeing many of them for year where they
Mm-hmm.
sacrifice for be with us for this 1 hour something now. Now, I
Mm-hmm.
mean, it really made my heart glad. So I appreciate the
Of
audience
course,
very
of
much.
course,
Yes,
of
we thank
course,
them
of
so
course,
much.
of
Yes, we
course, of
thank them.
course.
Yeah, yeah.
Yes, of course. Yes.
So
Okay.
yes. Uh-huh.
Okay. Thank
So
you very much, Pedro. You can always sign
thank you.
out. Thank
Yeah.
you.
Bye
Yes.
bye. Yeah.
Bye. Thank you.
Thank
Bye.
you.
If you sign out, just off your
Okay.
own, then you go. You. Yes.
Okay. Yeah.
Yes. Thank you very much. Have a
You're
nice
welcome.
day.
You too.
Yes. Bye.
Bye.
You know, go.
I look the place or sign off for my phone and it's yeah.
May I do it for you? Remove guest.
Yes, do
I'll do it for you.
Yes.
Okay, yes. So thank you all very much. We don't hear we don't hear from our guests. You don't tell we how to navigate with diabetes, and actually na a big lesson. Me, I am just a diabetes educator because I study about diabetes. I know the experience diabetes, so I know if you really give this explanation like how we don't get because the person way it experience diabetes. So now a great lesson for we don't learn am for here today because we don't hear am from the whole smile person wey get in diabetes sef e don explain am for we. So I really thank you all very much for joining. If you get any other questions wey you wan ask am, you can always ask them. If we need more of these shows then please let me know in the comment section if we need more of these shows then, so that I go look for means for invite people then when they get diabetes so that they will always join with us. They share us our experiences because I believe say in life when we hear something from the horse's mouth or when we hear something from person where it actually face that situation, there our mind it be broadened and would be open for hear any way the person is talking. So if you like this kind of way for create diabetes awareness, let me see it on the comment section so that we will try for look for people then so that if you always come for kind give we this information. Eyambe Elisa, Mama Elisa, Eyambe say, thank you, Pajo. We appreciate you as we appreciate you. What a wonderful day. Thank you very much, Mama Eyambe Elizabeth. I hope say any person where it back there where it is struggle with for manage diabetes. I want believe say up to this point, we don't learn something from Pajo because it talk experiences right from Cameroon until when he traveled to the US, how it do for manage diabetes. So it is very good. And I believe that myself as a person, as an educator, I don't really learn from him, from the experiences that I come to know what to be actually the problem with Cameroonians that they face and down there when it comes to managing their diabetes. So I really appreciate you for being here. Ian, me saw this, you are welcome. He said, I need it. Okay, you need this kind of show. Let me see on the comment section. If you need this kind of session, then please comment so that I feel see how I feel make arrangement. Every month, we feel get a speaker on diabetes so that if you can share with us our experiences. Let me see what our reaction if you now like the kind of show. Let me get from una reaction if una go like more of the kind of show the way I dey bring a guest speaker so that if he can be talk with we. Before while una dey comment, I want to appreciate each and every one of una who una dey here for this live for the support, especially just like Pajo talk, especially those wey dey watch from Cameroon. I really thank una very much. Thank una for using una data up to this moment, almost close to 2 hours for standing with us to learn and to contribute on diabetes management and diabetes awareness. I really applaud you guys. Yes, thank you very much. And together, like I always say, now all of this thing is not my team. We are creating diabetes awareness. It is for our Cameroonian community. It is for us, not for me alone, not be my team, you are now. We as a community builder, we are all building our community. Eyabi Elizabeth say, Madam Mira, gold and silver we have none. Is gold we ask God to bless you. Well, Mama Eyabi, thank you very much. Thank you very much. Amen. I receive the blessings in Jesus' name. Thank you very much, Mama Eyabi. Just your presence here, it makes me going and it makes me to keep doing what I am doing. Adewaka outside, greetings. Thanks, sis, for joining. Thanks. You just missed our host. I don't know if you watched the video behind, but we had a guest speaker in the house with educate we about how he managed a diabetes. So it was wonderful. If you always watch the show back or learn from the experience there, it's very lively and versatile with guest speakers. Okay, so we'll try definitely to add our guest speaker. We'll try to see how we bring guest speaker. Any person where get diabetes, be it diabetes, pregnancy diabetes, what they call and gestational one. Any person will say and say he get diabetes, we will try for bringing. Yes, it is versatile, no be lie. So we will try for add them into the thing. Oh my God, no, I did not. I just joined. I will watch. Okay, yes, then you really miss our guest because you don't talk plenty about diabetes, how you feel manage diabetes for Cameroon. So it was really awesome. Try for watch the show and you learn from it. So I don't know if we get any other questions. So if we drop and down so that we all will learn from and like Crystal Zone talk is lively when we bring guest speakers. So yes, because they don't touch only one thing, but they go over around, they touch almost everywhere. So we will try to do that. I'll try to add that on my shows. Thank you all very much. Mhm. Yes. Any other question? I want to say we said we don't learn. I also we don't learn from the show. We don't gain some knowledge. Ma, see some thumbs up. Please give the video a thumbs up. If you don't want to give the video a thumbs up, give the video a thumbs up. Let me see you just give thumbs up to our brother where he can help with for this show. So as it talk, make all of us will try for create diabetes awareness. Your own way out there for creating diabetes awareness. Now for you for share my videos, then for you for subscribe to my channel. Make sure to subscribe to my channel and then tag one or two persons so that if you always join with so that together we all can sensitize the public. Diabetes no be na thing for one person, but one I don't talk am too now for all we. If you see any person where it is struggling with diabetes, be it a friend, be it a family member, even an acquaintance, person where you don't know you just meet, but just for the fact that it talk about diabetes for you, with this knowledge where you gain am from here, help pass this knowledge out to that person, that brother or that sister because they need them. Some of them, they out there, they don't even manage their diabetes. Now, just for the simple reason, say they don't get this knowledge. When they get this knowledge, then they go feel manage their diabetes, they go feel navigate their way through this diabetes. And the only way for we for do it now, you and me, we will day here, we will get this knowledge, we will help for share them out with them. So it be very important. We will sensitize this channel so that other people then feel gain from this knowledge. I don't always talk say I'm being paid if I do my diabetes education, even though yeah I did do an for Dutch, I did do an in Netherlands, I did go do my educations in Netherlands, and then I talk now to English speaking people. No, most of the people I do my education in Dutch. So anything way I did talk for here, nothing way it there in Dutch, it be written, but then I did try for translate and for bring them for English so that all we will understand them. Yeah, so that all we will be understand. My educations are in Dutch. When I go to this patient, I speak in Dutch. I educate them on Dutch. But for I try for bring them down to the simplest way we have to do talk about English. Sometimes they say talk about pidgin, mix everything just for make us me everybody try for understand which way diabetes it be all about. So I beg more continue for sensitize our public. May they know it's the diabetes. May they take care of themselves because health is wealth. If you get wealth, but you don't get health, what value would that be to you? You know, we use and fight. So let's take care of ourselves. Ian says, sis, thank you for your sacrifice. My pleasure, Ia. Thank you very much. Yes, thanks for being here also. So the only way we will have to do with me, not just for the publicize me, show me out there to the public, that the true people they like una, where the public feel know me. When you come, you watch my video, and it makes sense to you. You learn something for them. Share them so that one or two people then they will learn also from that information where you yourself you don't learn them. So I really want to appreciate each and every one of una here. Thank you very much. Tomorrow is another day. So today in the evening, we'll not go get show. We will keep on and we'll keep sensitizing our public. So yes, kudos. I don't know if any question up to this point. I would like to take one or two questions before we call it a day. If not, and then I will just open. Crystal Zone say, I tell you, anyone can have diabetes. Old, young, rich, poor, fat, slim. Of course, everyone can have diabetes. Diabetes not only for Africans. No, Not be only Africans that they suffer diabetes. No, even the white people that they suffer diabetes. Not be only where Africans and they live with diabetes, but they don't know so they get diabetes. No, you get Oyibo them, you get white people out there that are living with diabetes, but they themselves they don't know that they have diabetes. So it is something that is global. Not be that thing for Cameroon, not be because of so you black, not be say you fat. No, we all see instances of people the way they drive, but still they get diabetes. We all see instances for people the way they eat healthy, but they get diabetes. We all see people the way they be so young in their age. How old our brother get diabetes at the age of 28? 28 now a year, an age where your life it just start, but then bam, diabetes enter you. Why? Because of a lifestyle from his mouth, because of his lifestyle, and because of genetics factors. Because if you get people there for a family where they get diabetes and they live a healthy lifestyle. So diabetes is global. Not be as until where it is select people there for choose that. Not because you get money, will come for you. No. If you are living an unhealthy life, if you get a family history on diabetes, know that you are liable to have this diabetes. So let us take care of ourselves. Let us take care. Always, and it come online, and they really stress about the things and more take care of ourselves. Because I am in the field, and you see the challenges the way people that they undergo and for bring their blood sugar levels or their diabetes under control. It is draining mentally, physically, emotionally, socially. It is draining. So for us when we not yet there for that stage for get diabetes, please take care of yourself. Live a healthy life. Be careful for which way you put them for your mouth, because now one of the factors and that the main factors for diabetes type 2, healthy lifestyle, which way you chop them. Not be everything when I chop you supposed to chop them. Some chop them, you chop them out of langa. Because you see that particular thing, you feel say you fit chop am. No, chop because you need that chop for that moment. Avoid certain foods then. And like our brother talk, since the way you know so they get plenty carbohydrate, limit the carbohydrate intake. Talk to me, you stop for chop the chop, they not stop am, but then you know say the particular chop, e get too much carbohydrate or e get too much starch, wey e mean say when you chop that particular chop, your blood sugar levels dem go high. Limit how you dey chop am. That is true. Diabetes management is hard. Thank you very much, Doc Lover. It is really hard. Now, why that way you see and when it reach at a certain point, some people they will just give up because the challenges they're too much. The challenges they really be too much, and our brother, it don't break everything down to us. If you are a Cameroonian, you are living in Cameroon, you are not restricted from eating anything you want to eat. Eat them, but then know the quantity you are eating. Not drink alcohol. It talk about he living an unhealthy lifestyle because of the group of people the way he be there with them. Always after their classes, after school, they will go out, they drink alcohol, and then the knowledge, if you lack knowledge, because they be telling you say, no, they drink alcohol, but it limit and not only to alcohol, it stop for drink alcohol, it stop for drink beer, but then it instead goes and they drink that juice, because they not be telling say sodas are not good for you. So sodas are not good. It's like come off a fry pan to fire, like somebody will put that under the comment section. So more will try our best for live a healthy life. Hello, Iya lawyer, you're welcome. Thanks, Iya Mado, you're welcome. Yes, our Iya Mado Metro, you are welcome. Thanks for joining, Big Sis. We just had an amazing show. We get a guest speaker all the way from the US. He tell me about the experiences of diabetes. So now we try for summarize them again. Yes, our celebrity lawyer in the house. So we try for summarize them. Let's take care of ourselves. You not get any sense. So you go out every day, you go hustle, you go work, and then all this money you can't put on for buy medications, especially diabetes medication. Diabetes medication are one of the most expensive treatment the way I don't come in contact with. I don't know about the other sickness and birth. I talk now way to way I don't see them. Diabetes it be very difficult for managers. So maintain a healthy lifestyle so that you go avoid forget this disease. It be very important. And now when you know what get the sick, try for make sure that you keep yourself in shape so that you know go start spend all this money where you only struggle your whole life now for the buy medication. So now we talk say diabetes it be very expensive. Wait till you get the complications of diabetes. When you get the complications of diabetes, now there you go really know say diabetes be expensive for manager. Now with the complaint say be expensive, when they say go buy yogurt where yogurt no get get sugar inside or no eat this food, buy na this particular food with the complaint say it be expensive. Wait, when you don't get the diabetes and then they prescribe you a drug and then you not get a social insurance or whatever you call it that way, or you not get an insurance where if you help for support you for buy this medication there. Now there you go know say it was preferable for you to buy this food or buy anything where you feel buy and than say may you go spend the money on buying medications. They are very expensive. So more put them for our heads. More no so they be expensive. Take care of yourself now. No wait when you don't reach for that time when everything it don't be damaged and then people start selling land, people start selling their properties just for cure you. Please, more take care for ourselves. So now ultimately I think I will tell you today. Also, make Christian Zone send your link, make I subscribe. Thank you very much. Yes, Doc Lover, her link is there. So you can subscribe to our YouTube channel. Thank you very much, Doc Lover, for reminding us. Yes, her link is there. She just posted. So I have subscribed. Thank you very much, Doc Lover. Yes. Someone will help our sister Krista Zone. She has a cooking channel. Who will help for subscribe. Go there. The other day she made a video showing us how to bake cake, a very simple cake she showed us. Someone will go support the channel. So thank you very much. Since my friend is on keto diet, she has 60 kilos. She is so frustrated. She is very active, does sport 3 times a day. Nobody in her family has a history of diabetes. I feel imagine it's very difficult and it's challenging. But the thing when I feel talk am Susan from this now this matter for this keto diet. Keto diet is fine. You understand? Keto diet is really good, but the problem with keto diet is how long can this your friend sustain it? How long is it sustainable? Because if you dey do keto diet only for a particular time, say me you lose weight, what if you stop the keto diet? What will happen? What is life after this keto diet? You remember say keto diet na a diet where it really be restricted in the amount of carbohydrate where you use that. They even limiting you for eating carbohydrate. So if it's sustainable, it is good. But if you not be sustainable, look for a diet plan, a healthy lifestyle, something where you feel sustainable for years. In about 3 years to come, Suzanne, you think that this your friend, he go still keep up with doing keto diet? If you go still be able to maintain this keto diet up to 3 years, that is fine. But if you want to do all these things, look for some things that you can sustain them. Because now the sustainability now it matter. If you do it for a longer period, not do something for short period. That is the more reason why she seems so frustrated, because it be restricted for do plenty things there. And you being frustrated, it only help for aggravate your blood sugar levels. She said she has been for it for 4 years. Okay, Suzanne, she has been on it for 4 years. She has recently been diagnosed. She has recently been diagnosed with diabetes, you see. So, voila, diabetes, remember, we talked about it. It can be because of your lifestyle. It can be from a genetic. So maybe if you live a healthy lifestyle, but just for the fact that if family they get a history about all you say, family not get a history, then it can be a problem with the pancreas. It can also be a problem with the pancreas. So maybe can tell us about keto and diabetes on other day as a topic on its own. Okay, I will try to do my research on it, then I can come out with something for us. Yes, because the problem is the sustainability. If you cannot sustain it, then it's not good. If you cannot sustain it, look for something that you can do for a lifetime. Now, why do they say it's a lifestyle change? Why? Because you have to live with it the whole of your life. If you are going to live for 50 years, make sure to carry that diet along with you. Yes, make sure to carry it along with you. Not do something where you feel frustrated. You being frustrated will not stress it at our blood sugar levels. So maybe if you've been just because of this frustration, where it be frustrated, it increase blood sugar levels. So maybe look for something where it be good for you. And for keto diet, if you know this sustain that, you know the struggle all this while, you know the eat carbs, you avoid for eat carbohydrate. Why? Because you want to maintain a good weight. Then that moment where you go stop for eat that carbohydrate, that where you go stop for do that keto diet, which you go do. No, you go jump back for start chop carbohydrate, and when you start chop carbohydrate, which will happen, I say your body will react differently. Where you feel easily gain all this weight where you don't lose them during those moments the way you do this keto diet. So for me personally, if you are managing diabetes, I'll not go tell you say do a keto diet. No, I not advise my patient to go on a keto diet because they cannot sustain it, and it's not even healthy. Your body needs carbohydrate, you still need them, but just limit them. You are very correct. We need to eat rightly. That is it. The most important thing is just for us for need rightly. And just like our host talk, our host on there, we say, you eat everything, but when it comes to carbohydrate, limit the intake of that carbohydrate. When you eat them, your body, your skin, it get used to those things the way you eat them, and then your skin also it be adjusted to those foods. Then if you just restrict them, you know, like for 6, 7 months, and then after just out of a sudden you start up again. No, your body itself will be frustrated, your body will confused. So any kilo where you lose them, you will definitely bring them back. And most often, these people they will bring that kilos very double. Yes, you are very correct. We need to eat rightly. That is the point, Suzanne. We need to eat rightly. That is very true. Very explained. Thank you very much. So I believe that we don't trash almost everything. Okay, Crystal Zone has something here. Crystal Zone saying, and once you stop keto, weight may hurt you big time. It may hurt you big time. Thank you very much, Crystal Zone. That is what I'm just trying to explain. Immediately you leave and the weight no even come like that particular weight to indicate that no, it will come like the throughout of your skin. So for me personally, if you are a diabetic, I will not advise you to go in for a keto diet. Just do you eat whatever you want to eat, but practice portion control. Be mindful on what you're putting in your mouth. No way to the chopper. Not be everything when they call and say chop, you're supposed to put in your mouth. Like I don't talk already. So, Banjo, thank you so much for sharing your experience with us. Indeed, it's really an eye opener. Just wait where you talk, it's really an eye opener for us now. Say wait, people them think say diabetes, especially for our African community. Most of us will believe say diabetes now for people that they old. Growing up, I be used to see now only old people that they get diabetes. So for me, my mentality now say now only old people they or aged people that they get diabetes. No. At what age when he gets diabetes? Very young, not even in his age, in his 30s, he get diabetes. So diabetes, it can affect everybody. So yes, thank you all very much. I wish you a wonderful day ahead. Man, no take una day again. Mona have a wonderful day. Una stay well, stay healthy, exercise just like Suzanne talk. Go for a walk daily. A 30 minutes walk can do you magic. So go for a walk daily. You don't need to do 1 hour. 30 minutes is perfect to go. So take the advice from Suzanne. Go to a walk daily. Thank you all very much for this wonderful and amazing show. Thanks for the contributions. I'll see you all tomorrow. Have a blessed day. Bye. Stay well and stay healthy. Bye, 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 bye to you all. We'll see you tomorrow. Ciao. Thanks you very much. Positive impact in our community. My pleasure, Suzanne. Bye. Thanks very much for your knowledge. Bye.